listening to us. We're turning the volume up. This is pressure.
You only hear us when it's trending, when the culture's hot, when it pays.
But the plan is sacred, healing, versatile. Not a talking point you use for a day.
Hemp, cannabis, marijuana, one plant, one truth. No GMO, but just what the earth grew.
Ask who benefits from keeping people in chains when corporations profit off the same thing they blame.
If you won't hear us when we speak it, then we'll make sure you feel the sound.
Not for noise, but for the truth now. We're applying pressure to the ground.
One voice, one sound, let it rise right now.
If you haven't been listening, hear us loud. This is not a photo op, not symbolic ground.
Pressure Squad, advocacy in action. One voice, one sound.
You talk freedom when it's profitable.
From science to lived experience, from patient stories to real world research. Today, we are connecting the dots between medical cannabis, public health, and the data that patients in Georgia need. Welcome to Compassion in Action, where advocacy meets real change, fighting for justice, equity, and healing, because every voice matters. Welcome back. I'm Yolanda, co-founder of the Georgia Medical Cannabis Society, and today I'm sitting in for our host, Angela, due to scheduling and work schedules. Today, we are honored to have Dr. Marion McNabb, president of Cannabis Center of Excellence. Dr. McNabb brings more than research credentials to the conversation. She brings public health lens, international experience, and years of work across cannabis research and real-world data collection. Before we get started, make sure you like, share, and subscribe to GMCS-TV and follow the Georgia Medical Cannabis Society to keep up with our patient education, advocacy, research, and community work across Georgia. I'd like to thank Dr. McNabb for being here.
Such an honor to be here. It's really exciting. I look forward to our conversation this morning.
Yes, indeed. And I know that usually it's Angela that hosts it, and I wanted to make sure we got on, but her work schedule didn't permit. But I want the people to know a little bit about you who haven't heard about who is Dr. McNabb.
Oh, thank you. Yeah. So, hey, everybody. My name is Dr. Marion McNabb. I'm a public health doctor by training. I also have a master's degree in public health. And I started off my career in public health and global public health, working mainly in HIV/AIDS, family planning, maternal child health. And when I decided to get my doctorate in public health, I was living in Ethiopia at the time, and I moved to Boston, Massachusetts in 2010. And spent about 8 years completing my doctorate degree there. And as I was doing that, I was specializing in global public health and looking at how mobile phones and digital health tools can improve the quality and the reach of HIV/AIDS programs and maternal child health programs, immunization programs worldwide, mainly in Africa and Haiti. And I was also intrigued as medical cannabis was becoming legal in Massachusetts. And I started to see more and more consumers and patients finding relief with medical cannabis. I'm a medical cannabis patient myself, so I was also intrigued and became a registered medical cannabis patient in Massachusetts. And then in 2017, the voters of Massachusetts passed adult use cannabis and legalized adult use cannabis in the Commonwealth. So as I was working globally at the time, I also saw a really great opportunity to understand and study and investigate more around medical cannabis. And particularly when I was living in Massachusetts, there's over 100 institutions of higher education in the state. And it's a real medical tourism place. There's a lot of, advancement, research, pharmaceutical interest in industry. And I thought it would be a really great place to advocate for expanding cannabis research and education. So back in 2017, I started a company called Cannabis Community Care and Research Network. And we ended up competing in a Boston University. I had graduated from my doctorate at the time. The year before, and ended up that Boston University had a cannabis startup competition for only BU students and alumni. And so I ended up competing with my business partner at the time to create a Cannabis Center of Excellence. The idea of bringing together patients, policymakers, healthcare providers, researchers, academics, and the general public together to advance cannabis research, because at the time it was still Schedule 3. I know we have advancements now, but it was very difficult to conduct cannabis research studies and to bring these all stakeholders together. And so we pitched this idea. We won the competition. We won a big $10,000 check. And we started out with our first research study, which was a partnership with UMass Dartmouth. And since then, it's been about 8 years. I've conducted citizen science-based real-world evidence research studies, and we met up about 5 years ago. I can't even believe it. Five. And 7, celebrating the 7th anniversary.
That's right.
Of the Georgia Medical Cannabis Society. So all the great work over 7 years. It's exciting to see all the events and all the really great discussions that y'all have been hosting recently.
Yeah, we're grateful to have come in contact with you, because I know Stanley was the one who introduced us to you and brought us in. Because, that was like in the beginning when you first met us, we were young. I ain't gonna say young, but we were new to advocacy because we just came in all bright-eyed, bushy-tailed kind of thing, like thinking like, okay, it's a plant. People want people to heal, and then you get into the politics of it. So,
and now you're leading in the politics of it, which is amazing, and putting together legislation around healthcare insurance, and it's really incredible the amount of work that has been done over the last 5 years. To give the audience a little bit of background, I was working in Massachusetts, and as I was explaining, I had partnered with UMass Dartmouth. We had launched a cannabis consumer and patient study back in 2018, and we collected over 2,400 responses and really tried to understand why people were consuming cannabis, and where did they get their healthcare information? Did they talk to their healthcare providers? We then launched into veterans work and launched a 2019 veterans study, and looked at veterans and how their wartime exposures and their health conditions differed with civilian populations. And we paired those studies with educational events and policy discussions and tried to drive policy change in Massachusetts. And then fast forward, COVID hit. We launched a COVID study, and it impacted my whole personal life. And I moved down to North Carolina, and we had to stop all the social equity work that we were doing in Massachusetts. And I had to close one of the companies. We closed C3RN. And that's when I partnered up with a Georgia group. And I was I'm from Georgia. I lived in Georgia, as you know. Okay. I went to high school in Atlanta, and how did I meet Stanley?
Stanley. Now, one thing about Stanley gets there. People will meet Stanley, and it's like, okay, hey.
Yeah. Oh, I remember because Stanley was working with us in Massachusetts with veterans work. That's right. He was, and that's how I first met him. And so back in 2021, so I moved down to North Carolina, and then I got linked up with a group called Georgia Atlas, which is how we all got connected. And how the first study launched. And the first thing that I did was the company that was back in the day when it was the first round of low THC oil companies, right? And the whole competition that ensued. So we were part of that, and we were one of those companies, and we only lost by a shy little bit, I tell you, just by a little hair. But I wanted to make sure that the group that I was working with, they had asked me to come in to help prepare the company, the proposal, what we were going to do, what the ethos was. And I played a pretty pivotal role, but I had asked them to ensure that social justice, working with patients, and supporting veterans were not just lip service, and that was actually part of the core value of the company and that work. And so in that instance, I was able to try and secure, commitment and partnerships. And that's how we got all connected. Reached out to Stanley, who then connected us, and we launched our first research study in Georgia at that time. Yeah. That was pretty incredible. I mean, that was at a time where people were really, I think maybe there was only like 30,000 patients or something with low THC oil cards.
It might have been, I think it was about 30. It was low then because it was very low because a lot of people didn't even know about the program because, we just got into the program, and plus there was no access. There was no dispensaries. We didn't get our first dispensary till 2022. Yeah. And so that's been a huge issue. So, but yeah.
Yeah. And it was a really groundbreaking study we did at the time. I mean, really, because dispensaries weren't even rolled out, and we had a whole section on COVID and how COVID had impacted patients' lives. And whether or not, and we saw trends, interesting trends, especially in the COVID where, people moving in. Cannabis is such a social thing. People often share cannabis when they're together and environments. And when COVID happened in isolation, obviously we saw a whole change in how cannabis culture was and how people interacted with the plant and with each other. But we also really at that time saw dramatic changes in the way that people were reporting consuming cannabis for. So originally, in Massachusetts, when we first started a lot of the work, chronic pain was the number one condition that people were choosing medical cannabis for. But when we started in our work in Georgia, all of a sudden, chronic pain was still there, but number one was chronic pain in 2021, but anxiety and PTSD and insomnia popping up as very high conditions for why people were choosing medical cannabis. And if we have to think about, condition and setting often when we're talking about research and about time trends. And so back at that time, we were in the time of lockdown and COVID, and you were just starting out, and we were using this data to educate providers and lawmakers. It was a very interesting time.
And I wish that more lawmakers were able to, I guess, go to and actually want to listen. And I know they get so much legislation, that type of thing, on their desk, and they have to run through it. And they depend on whether you're an advocate or the lobbyist. But so many of us advocates are either sick, can't make it out. It's the consistency. Exactly. Yeah. And then you have the lobbyists, that's their job. Because I realized that sitting in the committee room, watching them, like, I'm here at 2:00. I'm a log in. So yeah.
And the lobbyist isn't always there for the patient. The lobbyist is there for the business. And, these lawmakers do see a lot. And, I'm wondering what the temperature is now in Oklahoma, because it wasn't really a fully patient forward, program. I mean, having a really low THC oil, there's still a lot of education in Georgia that needed to happen at that time. And you've done a lot of work since then, just even what is cannabis? What is whole plant medicine? What is, what are you trying to regulate? And I think that's one of the biggest challenges across many states. And where I'm living now is in Oklahoma, and where you are in Georgia is, legislator education and regulator education on cannabis, because, the cannabis plant is complex, the industry is complex, and especially when you're regulating a medicine, and, you really need to be thoughtful about safety, patient safety, but also understanding business and wanting to support small business and business interests, but not at the extent or the expense of the patient.
Yeah. And I think I lost you see a lot of things when you are out there, boots on the ground, advocating, and you get a chance, whether or not you overhear quite a few things in the hallways. And I realized what we have to do is to continue to spread that message to different people. Say, look, you need to get inside and, talk to your legislator, either call them and let them know, because a lot of people here in the state of Georgia don't realize that their legislators that they continue to put in office are voting against their best interests. Yeah. So leading into that right there, I'm looking for the question that I was about to ask you, because it's like, what keeps you grounded in this work when the politics, stigma, and controversies get too heavy?
Yeah, what keeps me grounded? That's a great question.
Yeah.
I think, because it is an industry that is volatile. It is, difficult because there are these legislators that we do need to reach out to, and you do need to reach out to them in person, just like you said, either over the phone or face to face. It really makes a difference. What keeps me grounded is the fact that I believe in this medicine, and that I know I don't know everything. Nobody knows everything. But from what I've learned over the last 8 years, I still have so much more to learn about this medicine, the plant, how it works with people. And that scientific and clinical and social passion keeps me really grounded, because I know that I've seen science and that I can feel comfortable as a public health doctor that relies on evidence base for what I recommend or for what I speak about, that I feel confident that there is an evidence base. And if there's not, there's an evidence base in a wide variety of the areas of research that we need in cannabis. There's more to be done, absolutely. But I feel confident and grounded that I can have some evidence to stand on when we're talking to these legislators. And I think that's what makes a really important difference. And that's why I have approached my work with doing these studies and using this data that we produce to put that into policy practice and try and prepare, the way that we present these findings and the way that we're going to present our findings in Georgia is to be very snippet bite-sized, policy relevant decisions. I know that there's some legislation that's happening in Georgia. Maybe we can, refine and talk about some of the research findings in light of how, the legislation on insurance that you're interested in passing can go through. And I can think very clearly of some data examples right now from our research that we did back in 2021 and the study that we are doing now, which is around medication substitution. And many are actively choosing to reduce any type of medication, and how that can really impact insurance coverage, especially when you're talking about expensive chronic pain, long-term medications. If we're reducing that use, that could save public dollars and private dollars, very significant amounts.
And I know, looking at the fact that with the taxation, because when we go to the dispensary, we have to make a choice. It's so expensive. But that was during the time when the dispensaries didn't have flour.
Yeah.
But we're going to have it July 1st.
Yay for patient access and having flour. Woo. Yeah. Taxes, and back to the taxes. I mean, most medical programs are not taxed, and that's, a really big problem. And most adult use are taxed. And so that's why the dual use states, it's fit for patients. But that is a big barrier, and cost also is a big barrier for y'all. And especially because you don't have that many dispensaries and operators. And so that, when you have only a few, that keeps your price really high, and they are vertically integrated operators, which means they're making a large profit on what they're, making. But I'm really, really happy to hear that there's going to be expanded products, because that's really important for all different types of patients. And so that, when you have only a few, that keeps your price really high, and they are vertically integrated operators, which means they're making a large profit on what they're, making. But I'm really, really happy to hear that there's going to be expanded products, because that's really important for all different types of patients. And I think the low dose THC, back to what you're saying, low dose, and maybe these are low dose edibles. You need maybe 5 mgs, 10 mgs, maybe you've got chronic pain or something, or you have more. Now you're consuming more of those low dose that has sugar in it. You're spending more money for something that is, and then that's not, healthy and good. And so that's actually a debate that's happening here in Oklahoma, and it's important to have low milligram edibles, for patients that need it. But the problem here is accidental ingestion, and there's no limits on dosing on edibles here. And so that is, a little bit of an issue, in my opinion. I think we should have some limits. But I think in a medical only program, I think we need to be mindful that patients, like the number one group in our study in Georgia is chronic pain. Now, somebody with chronic pain is going to be taking other pain medications too, and requiring potentially substantive doses. And there's all different types of pain. There's neurological pain. There's all different types. We're just talking about chronic pain as a general summary. So those type of people, depending on if they have post-surgery or this or that, will need higher doses of THC content. And other patients, may not. Those with anxiety, depression may need more of a 1-to-1, and 1-to-1 THC CBD is always kind of recommended, and it's always really recommended to start low and go slow with your doses over time, especially if you're new. But I'm just excited to hear that there's expanded product selection now, because I think more patients are going to be able to benefit and not be seeking their products on the unregulated market.
Yeah. A lot of traction with that. We had quite a bit of legislation that was proposed. Cannabis was a hot topic in Georgia. And although our governor did sign the bill, he made it clear, I'm reserved about this. He hasn't been a proponent of cannabis, which leads me to Oklahoma.
Yeah, which they are not. The government here is also not supportive of medical cannabis. And that is a shame in both states. And I think a lot of the Oklahoma market, I just moved to Oklahoma. I got here in November of last year. I am a native Oklahoman, though. I was born here in Oklahoma City, and I'm a fifth generation Okie. So it's exciting to come back, but in interesting circumstances. The government here does not support medical cannabis program. The history of Oklahoma, and as I learn more and more, is quite interesting. And I just was on a podcast this morning with the author of State Question 788, which helped pass the Oklahoma program. And the Oklahoma program is very unique because it had the lowest barrier to entry in the United States. And that's from both a patient perspective and a business perspective. And I applauded the author, or one of the authors this morning, on that choice to make it as low barrier to entry as possible, because that's great for patient access and that's excellent for business access. And that's me coming from Massachusetts, which it was almost $500,000 to get a medical cannabis license. You needed $500,000 in a bond to just even apply. So coming from a state that had such high cost and barrier to entry to Oklahoma is very interesting to me. It's a very different market. It's, a very different culture and community around the businesses, and very different, but similar issues of what, the cannabis industry is facing. But just so the audience knows, in February of this year, Governor Stitt, the governor of Oklahoma, in his state of state, he called to have the public vote to end the cannabis industry here in Oklahoma. And that was primarily he's using a lot of data and using a report that's called the Texoma Report. And it's actually something that I and colleagues have developed another report that stated the state of Oklahoma that really provides a different perspective. But the governor is using this report that has been prepared that's using outdated data, sort of methodologies that are not up to gold standard for public health data reporting. And is more of a fear-mongering report. It was published by the police and really is now driving fear in the legislature. It's true in Oklahoma because it was such an easy barrier to entry. There were, at the beginning, a wild, wild west. Like 9,000 cultivators opened up. There was no oversight over the first couple of years of the industry. That's where it happened. And then the Oklahoma Medical Marijuana Authority got established, got pulled out of the DrPH, and now is, and the, licensees are required to register here with the Oklahoma Medical Marijuana Authority, as well as the Oklahoma Narcotics Bureau, OBNDD, who then also works with the DEA. So the OBN has been working over the last several years on enforcing illicit grows that have come out of those initial years. Either that was straw man operations where somebody made an agreement with an Oklahoman with the land and really had straw man, or set up just illegal grows. And so they've been doing a lot of enforcement. And to the point of our report that we recently published, notes a 77% reduction in cultivation licenses alone over the last several years. And I think that tone of, illicit grows, China operations, and rhetoric that has happened in the news has really overshadowed what the patients are and what the patients need and what our industry needs. We need to have that enforcement and we need to have that activity going on. But that same group and the government here also needs to recognize that Oklahoma has the largest medical cannabis patient population per capita in the United States, and that we have 2,000 businesses, and that this industry is not going away. It has become Schedule III, and to stop demonizing the industry and vilifying the industry. We launched a research study here in Oklahoma, and two of them actually. One is similar to the one that we're running in Georgia, and looking at patients, because as the program was rolled out, it was not required to input your qualifying condition. And so the state doesn't really have a clear picture of what the cannabis population is and the patient population is now in Oklahoma. I don't think that that's a problem now. I think we can change that simply. You can collect information in the future. But because there's a lack of that information, we wanted to launch a study to see what kind of patient, what does the patient profile look there in Oklahoma? What are patients consuming cannabis for? But we also wanted to look at businesses because the state is not supportive of the industry here. We wanted to ask businesses, what challenges are they facing? What successes are they facing? And what some recommendations do they have for the legislature, which makes the most decisions for how the industry is run here in Oklahoma. So our intention was to run these studies, but as we've been discussing, our whole goal was to prepare the data to put those findings into practice back at the legislature. So we, as a result, did a month and a half of data collection and then prepared a 138-page report of key findings. 17 key findings about how we believe that the state program is failing patients and how we believe that the state program can improve, and provide concrete recommendations for policy changes that can be put into place for some of the challenges that we're facing. But our goal has been to really share this data and education. I hope we can do this too with our Georgia study in a variety of ways. We've had a couple of in-person events here where we're bringing together local advocates, businesses, compliance experts, legal experts, really trying to get the picture of where the industry needs to go from a variety of perspectives. So not just the patient perspective, but thinking about the industry here is under attack as an ecosystem.
Yeah.
The patients can't live without the businesses. and the medicine that they produce. So it's been, an interesting introduction into Oklahoma and the market here. But I know you're working with several colleagues that I'm working with, which Summer Parker is for Safe Access.
Love her. Yeah.
She's, I think, interviewed with you a couple of times. She's our co-investigator on the study. So,
and she
meet all the time.
She's wonderful, along with Steph Shear. I see you coming on. And like I said, I make that joke about, I always tell her, I said, you know what? It seems like you're like the Erin Brockovich of cannabis advocacy. But then I said, wait a minute. Maybe Erin Brockovich is the Steph Shear of the, ecosystem fight. So I'm just like,
That's
know what?
Great comparison. Yeah, we are really, really excited to have her. So next week's a really big week for cannabis here in Oklahoma. First, CANRA, which is the Cannabis Regulators Association nationally, is having their meeting here in Oklahoma City. So all the cannabis regulators, and it's open to public, and
wow,
people that can attend. It's actually a pretty hefty price tag to attend the meeting, so I won't be there. But cannabis regulators will be here, and Steph is going to be there at the meeting, and so we're really excited. She's generously donating her time to us here in Oklahoma, and the advocates that put together this report and others to discuss about Oklahoma advocacy and this report and how we approach our legislators and what kind of bills we should be thinking about advocating for here and what approach we should take to advocacy here in Oklahoma. Because of, I think the governor here in Oklahoma is up. He will be no longer the governor in November and is not up for re-election. So what's going to be interesting here is who comes into power next and what they put into place and who they put into place. And if they change the agencies that are, change up the agencies that are overseeing and regulating medical marijuana here in Oklahoma.
And that's similar here in Georgia, because we're looking at the state now. That's why we had an opportunity. That's why I've been going to different candidate forums, because I'm going to the Republican, the Democrat, didn't matter, because I want to hear what they have to say and asking those questions. Yeah. Because the bill that passed this year was bipartisan. It's a bipartisan bill, and it passed overwhelmingly. Similar to the legislation that passed back in 2019 with that part of that study. So I get that. So dealing with that, what role do you think that the doctors and the public health researchers have when lawmakers are debating whether to restrict it or, I don't know if that's just coming back over,
Yeah, no, I mean, I think we play a really strong role. I was actually going to say what I have found to be in my last 8 years to be the most helpful is a public health perspective on this, because the cannabis industry impacts population health from a variety of perspectives. Okay. And I think we are trained as public health professionals to conduct research, to be evidence-based, to make sure that I'm specifically trained in developing policy and healthcare policy. And I think we serve as a really good role of understanding data, how to use that data to put that data into practice. How do you understand clinical medicine? Departments of public health, that's where most of these cannabis programs originally sat or, sit now. I think legislators really respond well to, like I said, to data. We're going to be, and in-person visits. So how I've approached it here in Oklahoma is I went with just a simple letter introducing myself as a public health doctor, establishing my credibility in the field, and explaining that I was going to be working with local community advocates and workers on a study. And so to expect this to come down the pike, and that we're, here to be collaborative. And our whole purpose of doing this is to hear and gather input from patients and business owners so that we can help inform evidence-based policy. And then I followed up with, okay, we've launched the study, just letting you know. We're going to be doing some events, and we'd like, you to come to these events, and then see if we can have some in-person meetings. And what I've realized is that, it makes a really big difference when you show up, back to what we were saying earlier, but it is really hard for patients who are bedbound or, people who have to work at a full-time job to do this. But I've been, able to go up and be in person and be in, meetings with these legislators, and it makes a big difference. And especially if they have data and information that they can use, because that helps them, when they make a case, because they're covering all sorts of issues and topics. And, if they're trying to defend a bill, having data and evidence behind it really has, and patient story has a lot of value. Now, from a clinical perspective, a clinician perspective, I am not a clinician. I'm a public health doctor who knows a lot about cannabis and about clinical cannabis, but I'm not a clinician. And I think clinicians are specifically important to speak to clinical communities. And I think we need a lot, and to legislators. I mean, having a clinical background is extraordinarily important in medical cannabis. This is a medical program. These are medical health conditions. A lot of our healthcare providers, over 80% of our healthcare providers, aren't even taught endocannabinoid system in their, pre-service education now still. And so the few doctors that we have that are experts in this area make a big difference. Their MD holds a lot of weight. And it holds a lot of weight for legislators, but it also holds a lot of weight for patients. And, making sure that they feel comfortable. But that's also, it's interesting when you look at patient and healthcare provider disclosure in our Georgia study and in the Oklahoma study and a study that was just published. It's very interesting because cannabis has been illegal, and, people are often choosing it, maybe not wanting other people to know about it. The disclosure around use is something that is changing over time and is very interesting.
Yeah, speaking of disclosures, even it was written into the law, which I didn't know the reasoning behind it, but they actually wrote into the law that the doctors would remain anonymous. And I didn't know if it dealt with the CJS amendment with the Roboc-Afar, to where they were actually rating the different dispensaries and different type of thing. So I was just wondering, will they allow the doctors to, well, really and truly, it's a Schedule 3 now. So any doctor can do it. That's why we're having trainings for doctors, physicians on the second Monday of every month starting in July.
Oh, that's great. I'm glad you're doing that. Yeah. And now that it's Schedule 3, it's totally different, but that's interesting that they were anonymous. And I think that is to possibly protect the healthcare provider because of any backlash, because of that federal legality of anything around insurance or anything else. That is a reason. I know in Oklahoma, you can opt to be, it's anonymous by start, but you could opt to be on a public register so that patients can but that's interesting. My first assumption is to adopt that would be more for protection of the provider. But I mean, how is anybody going to find the healthcare provider? I mean, I guess it's not anonymous on a state website, but they can still advertise their services outside of that.
Speaking of that, that's how we started with our organization, because being a patient, you don't feel like going, looking here and looking there. And I had to keep my mind occupied. That's why we developed, GMCS, and actually calling the doctor's office, say, hey, do you recommend cannabis? Do you do the cannabis evaluations? So many calls, hangups, and all this other stuff. It's like attitudes, because the stigma is real, calling around to different doctor's offices. So that's a piece of legislation that I'm pretty sure that we're going to make sure that we try to introduce this type of information to where it makes sense, because really and truly with the different classes we're having on the second Monday of every month. I'm trying to remember everything now.
Mm-hmm.
The second Monday of every month with physicians, and that's compassion in practice. So hopefully we can have you on one of those.
Yeah,
so
love that.
That's Angela hosting, and that is strictly sign in. We're asking for the physicians to come on who have questions about the program. So that's gonna start the second Monday in July. So I
think you're going to get a lot of people, a lot of participation because of the Schedule III, and a lot of questions around the legality of how now, if they can, recommend, and what is that process for becoming registered, to be recommenders. Yeah. And Oklahoma, you have to take a continuing medical education course that was selected by OMA in order to register now, and they have to be registered, part of a registry, physician registry. And so you can only, they went from hundreds of doctors that were not really registered to now you have to actually be registered and verified with the OMA in Oklahoma to be able to recommend for medical cannabis. I'm interested to see again how all this changes with Schedule III, and and what topics that your healthcare providers are going to want to learn about. I recently participated on a study that produced. It was a Delphi study that was published last year, in PLOS Network Open, that really outlined the clinical competencies recommended for doctors and nurses to learn, or really physicians to learn around medical cannabis, and what are those core competencies that should be included in pre-service clinical education. So I'm happy to share that article with you. It might be a good topic of discussion in one of these, in one of your healthcare provider events, and to see which that was a study that was produced by using a Delphi method with 25 different subject matter experts in cannabis from different pharmacy perspectives or mind public health and then clinical perspectives. So,
well, let's hope that you can come on and share it with the doctors. I mean, we'd love to hear it come from you if you come on.
Awesome. Yeah. I'd love to talk about it. It's, topics ranging from how do you legally participate? What are the legalities of participating, to what are the basics of the endocannabinoid system? What's the clinical pharmacology? How does it all work? What are the risks and benefits? That kind of stuff. So yeah, I'd be more than happy to come on. I think it's where we're at. I mean, what we've learned in our Oklahoma study and in our Georgia study too, is that, patients, we talk about healthcare provider communication. Our patients often know much more about their own cannabis use, what products they're selecting, their own personalized medicine than their healthcare provider. But it's coming at a point where healthcare providers can't ignore it anymore because of this medication substitution effects that we're seeing, and the evidence coming out about the opioid sparing effects surrounding medical cannabis. I mean, these are clinical conversations that we can't ignore anymore. Yeah. And I think now with the federal Schedule III, there's just that federal nod to the fact that there is medical value and evidence. We can break that myth that cannabis is not just for the stoners, and that we can really further explore, cannabinoids, and that markets would then, groups, Georgia and Oklahoma need to pass legislation to fund education and research in these areas. That's, I think, where states need to be headed next.
Yep. I have two more questions.
Absolutely.
Two more questions, and I'll let you go because I know you're busy doing these studies. Now,
I always love talking with you.
Yeah, I love it too. Oh my God, yeah. But if I know here in Georgia, we spoke about the federal government and everything getting involved. A couple of years ago, Georgia was the first, once again, being the first to do something. They were the first to go ahead and allow pharmacies to dispense. Now, they're able to dispense now because we have pharmacies that have come online. Okay. Do they have the cannabis available for pharmacists to dispense there in Oklahoma, or are they thinking about it?
No, that is far from where this model is. And I think that's actually probably a little bit of a disappointment to the state. So the state, I think the legislators and folks here really wanted a medical focused program. I think they wanted a program that was funding research and that was really intentionally driving patient outcomes. And I think because it was so open and wild, wild west here, and then there's become such illicit activity, it has really soured the taste of legislators and the public. And that's why the governor has called to a public vote to end the industry, because there has been some, negative impacts. So the pharmacies are not required here. I'd be interested to hear what the reaction is from patients and, in Georgia from the pharmacy model, because it's definitely not here.
And, that's one thing that I was going to talk to you about offline, but we do have a survey, a citizen survey that we want to pretty much send out to the patients, because right now, by it only being limited dispensaries available, it's actually not a patient's market.
Yeah.
It's a dispensary market.
Go ahead and change our survey that we're running right now, and a plug for our 2026 Georgia medical cannabis patient study. If you are in Georgia and you are 18 years or older and consume cannabis, or are a caregiver of a pediatric patient, please take our survey. We would really appreciate it. And so maybe we should revise our survey to include that question right now. I'm going to note it down, about
the quality.
Patient access,
the quality, because I'm gonna tell you, to get your meds after spending all that. That's why I was just concerned about the shelf life, because when the first rollout that came out, we didn't even have expiration dates. We didn't have the safety. Like, I'm gonna show you off camera, off scene, is some of the things that we spoke about, because it's some of the things that I spoke about safety. And the reason why this stigma is the way it is because if you have your medication that's set to where a child could get it, that's where that's where we get all these different news reports fueling the stigma.
Yeah, and that's what happened here in Oklahoma recently, is a real cases of young kids. And that's why having limits of milligrams in edibles is important, because a kid was able to access 1,000 milligram edible. And that is too many milligrams, and was out for the count for about a couple of days. The kid is fine. We have to remember there's no overdose on this, no deaths, but it is not a good experience. And that's something that should be said for sure.
I've experienced taking a little bit too much. However, having the antagonists around, like the CBD and stuff like that, to try to bring me back to a grounding method. But a lot of times you're in so much pain, and now that it's going to be a regulated market, at least I know I'm able to go and get what they claim what it is, and I know I'll have some consistency in that.
Yes.
But for my last question, I think this is going to be the last question, but the last question is, you spoke about the public policy and as far as your studies and stuff. How can people reach out to you? Because I know Alabama just rolled out something. How can other states reach you?
That's a great question.
If you want to do a study.
That's a great question. One, you can reach out to me on my email. If anybody's interested in doing a study in any other state, please reach out to me. Okay. I have conducted, my email is Dr. DOCTOR Marion MARION McNabb MCNABB @gmail.com. Okay. would be more than happy to discuss any study in any state. And if advocates have even a specific purpose for doing so. When I started this work, I'm happy to adjust these questions like we just said tonight. That's the beauty of being a nimble cannabis researcher, is that I can be like, you know what, in our conversation, we need to ask that question because that question is going to help us with, the future work. And I can change that. And I can do that without having to get 400 million approvals from everybody. So, and I think it's really interesting that, I've been doing this work in Massachusetts and now New Jersey and Oklahoma, here in Georgia, and there are differences by different states. And although there are similarities, people are consuming, for similar health conditions, but, like I was explaining this morning, the opioid epidemic is less of an issue in certain areas than it is in others. And so, the role that cannabis can play for that, is different. And maybe Alabama folks are struggling with, whatever they're struggling with, we can really dig into it. So you can also reach out to me at the Cannabis Center of Excellence on our website, www.canna-center of excellence. And then I just launched a new website and might be, now with this question and the interest, might just launch a national study because it's popped up on my new TikTok channel. People have really resonated with hearing the work that we are doing here in Georgia and Oklahoma and other states too. So if you want to follow me on TikTok, it's at Dr. Marion McNabb. That's my new educational channel. And on Instagram at Canna Citizen Scientist. So I'll be doing a lot of short-term education videos talking about our data. And then you can also follow all of the social channels of the Cannabis Center of Excellence. So we're out there trying to continue to make change. And so, anybody in any state, please feel free to reach out. We've got the templates. We can be nimble, and we'd be very, very happy to collaborate.
Okay. And like I said, I thought it was going to be the last question, but you just go ahead and just let us know. I know you mentioned it throughout the podcast, but just to highlight what's going on next week, you got Steph Sherry coming and y'all doing some big things there in Oklahoma. So
thank you. Yeah. And if you're not in Oklahoma, you can tune in online. We will be live streaming this event. So it's going to be with Steph Sher of Americans for Safe Access. She's going to be here in Oklahoma. It's on June 11th, and we're going to do an in-person networking event at 533 Northwest 30th Street in Oklahoma City. It's in the Paseo Arts District. And we'll have a panel discussion. I'll be the moderator of the discussion, and we'll have a local experts who are healthcare providers, patient advocates, Summer Parker for Patients for Safe Access will be there. Katie Nail, who's our master's in clinical therapeutics, nurse practitioner colleague. And we have Steph Davis, who's a paralegal, cannabis expert. She'll be there. And we'll all be interviewing Steph, really trying to dig into our report that we prepared in Oklahoma and what advice she has for us and what the future of Oklahoma is. So if you want to join us online, you can join at YouTube at WTHC Radio. And thank you so much for having me on today. This has been a really great conversation, Yolanda. I really appreciate our ongoing 5-year partnership. Now I feel like we need a little medallion celebration or something for 5 years of, working together.
Gotcha.
Yeah. And once we complete the results, I'll change our survey with adding those questions. And once we complete it, we should do another that really digs into all the key findings.
Definitely. And also, we got something coming up with that. Sure. I'm going to share that with you offline. But how can these studies aren't cheap? I said that was the last one. I gave you the intro, whatever. How can they support you financially? Because look,
yeah,
let them know.
Thank you. These are labors of love, and the ones that we're doing right now are actually pro bono. So if you are interested in financially supporting, we do have a PayPal. You can go to PayPal, the Cannabis Center of Excellence. or reach out to me with my email. And actually visit the Cannabis Center of Excellence website. We have a donate there page too. But reach out to me, Dr. Marion McNabb at gmail.com. And we would be ever so grateful for any donations for any of this work. So thanks for calling that out.
All right.
All right. Are you a Georgia medical cannabis patient? We would love to hear from you. We would love to hear from you. Please join us in the 2026 Georgia Medical Cannabis Patient Study, where we're asking patients how and why they consume cannabis, for what health conditions, where you get your information, and if you're having any issues related to access in the new Georgia medical cannabis market. With these new laws that are changing, your voice can really help us, help you, and help the industry. So we're not only collecting this data, we're going to be using this data and putting those findings into practice and sharing this information with our legislators in Georgia to help push and advance for legislation that's supportive of medical cannabis patients. So please take the survey. You can see the link here, and it's fully anonymous, and we will be sharing the results back with you and with the community. So thank you so much in advance for your time.